Hi, I'm Dr. Joseph Witt-Doerring. It's my pleasure to be joined by Laura Vigiano today. She's a licensed clinical social worker, and she has a really interesting story to tell. She had a very close call with a antidepressant withdrawal injury where reinstatement was able to, um, I guess, stop the akathisia, and she recovered from it. She also shares very interesting perspectives because she in fact worked in psychiatric hospitals and outpatient units for 18 years doing psychotherapy. Since then, she's also been a moderator for several Facebook groups as well, and concerning drug injuries, and she just has a wealth of knowledge and experience. So welcome, Laura, and I'm going to dive right into it and ask, please tell us what happened to you.
Oh gosh, I'm sorry.
Yeah.
I'm sorry.
That's
It's
okay.
hard
Just
to
take
talk. It's
That's all
hard
right.
to
Take a
talk
moment.
about. Um, I'm gonna look like a Looney Tune.
No, it's okay. It's all very emotional stuff, and you're not the first one to get emotional talking about this, so it's
Thank
okay.
you. Thank you.
Mhm.
Thank you for the work you do. Okay. So I worked in a psychiatric hospital in both inpatient and outpatient, primarily outpatient, but it was outpatient day program. So people were there 6 hours a day for 2 weeks. Everybody was on meds, multiple psych meds. And I had treatment teams with the psychiatrists almost every day, while also doing some work in the inpatient. So while I was still working, I developed a chronic illness called chronic fatigue syndrome. And a psychiatrist told me that Cymbalta was a good drug for that. Now, I had been depressed in the past. I had been on a number of antidepressants and never had a problem stopping them. They all made me hypomanic, which in retrospect was a huge problem. I made decisions I never would have made if I hadn't been hypomanic. And I'm very lucky I did not lose my child and did not lose my job. So that's one very prevalent problem with antidepressants. And frequently, psychiatrists diagnose people with bipolar who have a manic or hypomanic episode. But it's a side effect of the antidepressants.
Mhm.
And I was diagnosed as bipolar. I never went on any of the mood stabilizers, thank God, because they're very toxic. But anyway, so that's another part of my history with antidepressants. I've since learned how common it is, a side effect, and it is a big problem because then people get diagnosed bipolar and they get put on bipolar meds when really it's a side effect of the medication.
Mhm.
So anyway, so years went by. I was on and off antidepressants, and at the time that I got chronic fatigue syndrome and was still working in the hospital, and my psychiatrist friend suggested Cymbalta, I was not depressed. I was not in pain, which are the two major reasons Cymbalta is prescribed. It's now the go-to drug to treat fibromyalgia.
Mhm.
There are probably more people in the Cymbalta taper group with fibromyalgia than depression.
Yes.
So anyway, I didn't have depression. I didn't have pain. I'm one of the lucky ones with CF, chronic fatigue syndrome, who don't have pain. But on his recommendation, I said, "Oh, well, sure, I'll take Cymbalta." So I was on it. I'm still on it. I'm still tapering. I'm down to three microbeads, and it's taking me a year to get off the 4 microbeads. I'm now dropping one bead every 3 months, but I'll talk about that later. So anyway, I get on the Cymbalta, years go by, it never does anything for my chronic fatigue syndrome. As a matter of fact, I get so bad, I have to stop working. I've been disabled for 8 years. But when I tried to go off Cymbalta, at a certain, I really never saw psychiatrists. I always had my Cymbalta prescribed by my regular physician.
Mhm.
So when I talked to my regular physician about going off it, she did not want me to go off it. She thought it helped my chronic fatigue syndrome. It did not help my chronic fatigue syndrome. So without her knowledge, I went off it. I think I skipped a couple doses and then I just stopped taking it. I was taking 60 milligrams, which nowadays is not a high dose. A lot of people are on 120 milligrams.
Yes.
So I stopped it cold turkey and I got command hallucinations in 24 hours to kill myself. Maybe like 2 days to kill myself. It was terrifying. It was a voice in my head telling me to kill myself. Immediately went back on it, didn't know what to do, stayed on it another few years, finally found this group on Facebook called Cymbalta Hurts Worse and learned how to open the capsules, count the microbeads, and gradually reduce 5% every 2 weeks. Although back then it was 10%. You were allowed to do 10%, every 7 to 10 days. So I did that, got off the Cymbalta in 8 months, didn't have one warning sign, one withdrawal warning sign telling me I was going too fast. 6 weeks after I was and I felt great. I was like, whoa, I'm off Cymbalta. This is great. I think it had made me gain a lot of weight. So I was happy to be off it. Felt terrific, not depressed, not anxious. Was having weird bursting into tears episodes, not ever when I was alone, only in interactions with others. And they were very bizarre because there was no warning I was going to burst into tears. And I never experienced anything like it, but I didn't think, never, ever thought, oh, this is because I went off Cymbalta. So then 6 weeks, I'm off the Cymbalta, 6 weeks, I get hit with akathisia. I had to pace. I couldn't sleep. I couldn't eat. I was hungry, but it was like, you know how when you get really anxious, you don't feel like eating? It was like that magnified times 100. I could not put food in my mouth. So I forced myself to drink broth. And now I knew what had happened. I knew it was withdrawals from the Cymbalta. I got delayed withdrawals, which is also very common and can happen weeks to months after someone goes off Cymbalta too quickly.
Yeah, and just to kind of jump in there, because I think that's a really interesting point. That is a real curiosity about this, because I hear this again and again, and I've seen it in my patients. We will finish an antidepressant taper and they'll be fine. And then 6 weeks later, that's when it really, the problems really kick in.
Yeah.
And I don't really, I'm trying to think about a way to understand that, but it's hard. I mean, the only
have you seen Anders Sorensen's research?
No, I haven't.
You must learn about him. He did some research. It's not that recent now, but I recently learned about it, where he learned he has charted the occupancy in the brain of the drug and of Cymbalta. I don't know if he's done it for other drugs. And he discovered, this is so exciting to me, that it's at the very tail end of the taper that most of the brain's receptors are opening. That's why when I got down to 9 microbeads, I've been tapering. I did late reinstatement. I was successful with 30 milligrams after I got hit with the akathisia, which was absolutely horrific. And I was going to kill myself if late reinstatement had worked. I had to play around with the doses. But anyway, Anders has discovered it's fascinating that this is when most of the receptors are opening. And that's why now at 4 microbeads, when you'd think, oh, I can just stop taking it, I'm down to 10 microbeads. I'm down to 2 milligrams. What does it matter? And this is what doctors think. Doctors think if you're on 20 milligrams, that's a low dose. It's at 20 milligrams that the real danger when you start to go off it comes.
I've heard a lot about that. But I guess the thing I find interesting is, like, why wouldn't it be, say, a week after you finish, the 2 beads? Why is there this? Because by that time, I mean, the drug is out of your system, but then there's this delay for another month before it really kicks in. That's the curiosity part for me. And And I just think that's very interesting that that happened to you, because I've seen it with several of my patients. But please, please go on. So you
Yeah,
realized that you were in Cymbalta
interrupt
withdrawal.
me,
Yeah.
interrupt me whenever you want, because I'll just keep talking.
Okay.
Okay, so I got this horrific akathisia, and I want to list the symptoms. My arms and back felt burned in a fire. I later learned that's called paresthesia, which I'm sure you know about. It wasn't painful, but it was really weird. So the only way I can describe it is they felt burned in a fire. I could not eat. I could not sleep. I had to pace. I couldn't focus my vision. My vision was blurry. And my brain, it's really weird. It's hard to describe. My brain felt huge. I just felt like I was nothing but brain. And then a week after that, I got hit with a fatigue so profound, I could barely stand or walk. It felt like there were 50-pound weights. Have you heard of this? People
Yes.
describing this symptom? It's really strange. Felt like there were 50-pound weights strapped to my legs. Now, here's a woman. I was practically bedbound with chronic fatigue syndrome, and I never felt fatigue like this. And because of my years being bedbound with chronic fatigue syndrome, and now getting hit with this fatigue, that was it. The Cymbalta Hurts Worse group at that time warned you cannot reinstate past 2 to 3 weeks. You could get suicidal or homicidal, because there was a case where a man became homicidal. So, but I was desperate, so I reinstated.
What did you reinstate? What did you reinstate at?
Okay, that's a good question.
Yeah.
I didn't know what to do, so I Googled, and I found something. I cannot remember what I found, and I don't know if I can find it again, but it gave me a formula for how to figure out what to reinstate, and it said, don't go too low. So I used the formula, and I tried 40 milligrams. So originally my dose was 60. I tried 40. It made parts of the akathisia much worse. Now, it got rid of the fatigue, which was a huge relief, but now I really couldn't sit still. I had to pace. And my brain felt lit. And throughout all of this, it was so strange. I'm not an anxious person. I don't have a history of anxiety, but I have a history of depressed mood. And throughout all of this, I was not depressed. I felt really rational, ultra rational. Like I've never felt so rational in my life. And I was just watching what was happening and trying to breathe, use meditation techniques to deal with it. And, how was I going to figure this out? I was not upset. It's very odd. So then I reinstated the 40. It made some parts of the akathisia worse, but it made some things better. Like it got rid of that horrific fatigue where I couldn't stand or walk. So I felt like I'd made the right decision. So then the next day I tried 20. And I stayed on 20 for a week, but the fatigue came back. I couldn't get up off the couch. So then here's the other thing. You have to be very careful about increasing and decreasing the dose. The brain craves stability. And I knew this. I knew from the group, it doesn't like jumping around in the dose. So I was very cautious about moving my dose around, but I changed it twice. I changed it from 40 to 20. That wasn't enough. I added 15 microbeads. That brought me to 100, which was just under 30 milligrams. And that's what I stayed on. And gradually, 3 months, I got better. The last thing to go was the profound fatigue. And then I started tapering.
How long did it take for those symptoms to settle after you began reinstating? Was it a week or 2 weeks? Yeah.
After I started reinstating, every day it got a tiny bit better. And I kept a journal. This is important for people to know. When you're having any kind of problem with a med, keep a journal. It's the only way to know, for you to see what's happening with your symptoms. Otherwise, you can't really tell from day to day. So I kept a journal and the other thing was this dizziness, this massive dizzy headache that was so uncomfortable. And so I kept a journal, and gradually the dizziness went away. I'd say in 2 weeks, it was a big improvement. But I remember a cousin came to visit, and I'd really been looking forward to his visit. And I was in a wheelchair.
Mm-hmm.
I mean, I have chronic fatigue syndrome, so I have a wheelchair, but I normally don't use it for little,
Sure. Okay.
little distances. But I was in the wheelchair, and I was not good. I was shaky, and I wasn't myself. And that was, I don't know, that was probably 3 or 4 weeks into it.
And so so eventually you got back to baseline. It sounds
Yes.
like after, yeah. And
Yeah,
then
3 months.
So tell us about how you've tapered since that time.
I love talking about this.
Yeah.
Because it's so ingenious and it's so important, and people don't know this. Doctors don't know it, and people on Cymbalta don't know it. How would they ever figure this out? Because doctors and pharmacists think a lot, some, maybe not all, but some think if you open the capsule and take out the microbeads, you're somehow compromising the microbeads. It's not true. It's the only way to go off a drug like Cymbalta. You have to do it so slowly. There's one more thing I want to mention before I talk about how to taper. You and I, we just talked about delayed withdrawals. This is the thing. A lot of people come into the Cymbalta Hurts Worse group. There's 36,000 people in the group now. There were 33,000 2 years ago. 36,000, that's a drop in the bucket for the millions and millions of people that are on this drug.
Mm-hmm.
Makes me so sad. That are on this drug all over the world who can't get off it safely. So anyway, here's the thing to know. People would come to the group, we'd explain how to taper, and it takes years. It's going to take me 6 years to taper off. And they don't want to do it. They're shocked. And maybe they dropped from 60 to 40 and they didn't have withdrawals. The problem is this delayed withdrawal thing. You don't know if you're going to be one of the ones who gets hit with delayed withdrawals when late reinstatement is so difficult. So that's why.
It's not just difficult. I mean, it's unpredictable. Not everyone, late reinstatement won't work for everyone.
It's, in my experience, it's rare that it works.
Yeah.
In the little bit of people I've tried to help. Anyway, so that's why. Even if, you're doubtful, I've gone off other meds, this didn't happen. This is the problem. You won't get warning signs, and then it'll be too late, and you'll get protracted acute withdrawal syndrome, which on the average takes 2 to 3 years to recover from. Many people, it takes longer. People are lying in bed in a dark room for 2 years. That's how bad protracted acute withdrawal syndrome is. They can't function. They're disabled. Their families don't believe them because doctors tell them there's nothing wrong with you. So they come home and they say, doctor says there's nothing wrong with me. Their families give up on them. They lose their jobs. People become homeless.
And so when you started tapering again, what was the pace that you thought that you landed upon that was good for you?
Okay. Here's the thing. It's not a matter of what's good for somebody, because as I said, you can go through your whole taper. I did it in 8 months, didn't have one withdrawal sign that I was going too fast because I was doing 10% every 7 days. So you must follow the taper instructions, which Cymbalta Hurts Worse, that group, has developed. It was developed 8 years ago by 2 psychiatrists, Dr. Peter Brennan, and oh gosh, I could never remember, a woman psychiatrist, along with the founder of the group, Tony Samani. They developed this way to do it. And what you do is you open your capsule, you either count or weigh the microbeads, and you drop 5% every 2 weeks. So there are many different brands, generic brands of Cymbalta, and they all have a different number of beads. And some of the brands will have 5 large beads. You cannot taper with beads that are 5 milligrams. It's too big a drop. So then you have to change brands. And the group has a list of brands that have the microbeads. You have to change brands and get a brand that has microbeads. And if you have like 400, 500 microbeads in your capsule, you probably want to weigh. You get a jeweler scale. The group tells you what kind of scale to get. Here's the other horrible thing about this. Some people get withdrawals when they change brands. And that happened to me. I was on this, Walgreens was giving me the same brand for 14 years. And suddenly I got a different brand. I didn't think anything of it. Was I in the group then? I don't know. I can't remember. Can't remember if I was in the group.
So sticking to one brand is ideal. Yeah.
I got a different brand and I got withdrawals. And I had to, Walgreens couldn't get my brand anymore, Ajanta. I called every drugstore in my town. Nobody could get me Ajanta. Finally, I found a drugstore called Family Pharmacy that specializes in it's a compounding pharmacy, and they've been ordering it for me ever since, and they mail it to me. Okay. But that was another life and death situation. I had to get Ajanta. Who knew I could have gotten pause from that? I could have had a protracted acute withdrawal syndrome for years from that, from changing brands.
Okay. So since then, was that pretty consistent for you? You did 5% every 2 weeks?
Once I reinstated on a little bit under 30 milligrams, I did follow the directions to a T. I did 5%, held each drop for the full 2 weeks, had no symptoms. Oh, at 50 beads, the taper instructions tell you to start dropping 1 bead every 2 weeks when you get to 30. To be extra safe, I started to drop because of my Akathisia incident. I started to drop 1 bead at 50 beads. So now when I got to 9 beads, I started to get the bursting into tears thing, but not bursting into tears. My voice would crack when I would try to compliment someone. I tried to yell over my fence to my neighbor what a good grandma she was, and I couldn't talk. My voice cracked and I was going to start to cry because it moved me to tell her she was a good grandma. And I wasn't quite sure, is this a withdrawal syndrome? And then it kind of happened a few more times. I wasn't bursting into tears. My voice was cracking. So I knew.
Let me ask you this. So when you drop to 1 bead, roughly how many milligrams of Cymbalta are you when they tell you to slow the rate?
That's a very good question, because for everybody, it's different. Mm-hmm. Because my 60 milligrams only have 220 beads in them. Each of my beads is 0.27 milligrams. Mm-hmm. For somebody who has 400 beads in their 60 milligram, their bead is going to be a much lower dose. So their taper is actually going to go slower than mine. I can't go slower than 0.27 milligrams for each drop, because that's what each bead is. And you can't smash the beads.
Mm-hmm. Okay. So how far through the going down the 20 were you when you decided that you wanted to slow down the rate? Were you halfway through, 2/3 through? How
of
roughly
the milligrams?
Yeah.
Of milligrams? Okay, here. I can't do it in my head. Let me just real quick with my calculator tell you. So at 50, when I started to slow down, I was at 13.5 milligrams.
Okay. So
that was just to be safe. No withdrawal symptoms. Now, when the withdrawal symptoms hit, the weird cracking of my voice, going to burst into tears, I was at 2.43 milligrams. That's when I started to get a withdrawal symptom.
And did you hold at that time, or did you keep on going?
No. You have to, if you start to get a withdrawal symptom, you must hold, and then you must proceed at a slower rate. So at 9 beads, 2.43 milligrams, when I started to get the weird voice cracking, going to cry, I started to drop 1 bead a month. It helped, but it was still happening. So when I got to 4 beads, I started to drop 1 bead every 3 months. And I thought the crying was all gone until I just started, until this interview.
Yeah.
But no, the one bead, the one now at 4 beads, 1 bead every 3 months. I can compliment somebody. Here's my test. I was in an elevator and there was a woman with a very old dog. I'm going to start to, oh God, I might get tearful. But I was able to compliment her on her care for her 19-year-old dog without my voice cracking. So then I knew my dropping 1 bead a month is working, because I could say, oh, you take such good care of that dog. That's the kind of thing that I would have started crying.
Sure. Okay. And since you've been involved in a lot of the antidepressant support groups, and you've been moderators on some of them, have you seen some people where this plan, despite following it, they still end
Yes.
up with the
Yes.
problems?
Oh my
Okay.
God, you ask all the right questions. This is
Yeah.
the very tragic thing. In the group, there are people who follow the taper instructions. I am very lucky that if I follow the taper instructions and I listen to my body when I get a withdrawal symptom and I slow down, I'm good. Like here I am dropping 1 bead every 3 months and I'm stable. I feel this is working. There are people, I read the other day, there's a woman on, she had to hold at 35 beads for a year.
Mm-hmm.
There are people who every drop from when they start their taper, their first drop, they get withdrawal symptoms. Those people, it almost seems like it will be impossible for them to get off. And they're looking at years if they can even do it. They suffer with withdrawal symptoms, even though they follow the directions and hold. And they're what can I say? They post on the group, I don't know the word to use, just desperate for help. What do I do? Do I go back up? Because the group is very careful about telling people. Sometimes they'll tell people, all right, you're still suffering. You've been holding this long. Try going up a bead and see if that helps. It's really tricky. It's very tricky stuff.
Yeah, I have a theory about that. Well, it's just a theory. I mean, I'm going to caution, this isn't an explanation for everyone, but in my cohort of patients who I treat, when I have some patients who respond to every single drop, I guess, with a worsening of symptoms, they have a few things in common. One, they have severe symptoms at baseline. Typically, they are, their protracted withdrawal symptoms are pretty nasty. And then I also think that they have like a PTSD type reaction to drops, because a lot of these folks, if you get their history, they may have been injured doing, in a detox type of setting, or when they've rapidly decreased their dose. And so they have this association with, oh my God, if I drop this, things are going to get terrible because they've been injured in that way. And so, they're already doing really poorly because they have pretty severe post-acute withdrawal. And then they have this almost this trauma reaction every time they do a drop. And these drops can be minuscule. I mean, they could be like a 1% drop or something like that, but it's still that same reaction. And I guess the way that, I wonder what, is happening with them is, it's a combination of a kind of a trauma reaction that floods them with adrenaline, and then it makes them feel worse for several days. And then they think, every tiny drop,
yes, I can
them.
imagine they would dread if they get worsening of symptoms. Of course, they're going to dread any drop. It's going to produce fear.
And then there's a cohort of that group who might do well on a blind taper. Some people, you put them on a blind taper and they
Dr.
hate
Joseph, it. What's a blind taper? I just saw that recently.
Yeah.
I don't know what that is.
So blind taper is where a doctor will write a script to a pharmacist, and for the sake of it, let's say we're talking about trazodone and someone wants to go from 75 to 50. I would write a script that says, trazodone, 75 to 50 milligrams. And then in my directions, I would say, 70 milligrams for 10 days, 65 for 20 days, 60 for 10 days, and so on and so forth down to 50. And then I would get a release from the patient to give to the pharmacy saying, I, the patient, understand that I will not know the dose of the medications. I know that they will be
Oh,
between this and this, and I'm the only one that knows what it is.
oh,
And so it
okay.
gets dispensed by a pharmacist in a box where all of the pills look the same. And
Oh,
then
okay.
and then that way they don't actually know when the drop is happening, and they're less
Yes.
likely to have all of that anticipatory anxiety when the
Yeah.
drop day
Yeah.
comes. So
Oh, that's good.
some people like it, some people hate not knowing. So I mean,
Yes. Yes.
again, it's not this thing that works for everyone, but I have seen it be successful in some of my patients. Yeah.
Yeah. Okay. Thank you for
Yeah.
explaining that.
hmm So okay, so I think what I think would be really nice to ask you about is how your perspective on psychiatric medications changed throughout your career. From what you saw when you were working in these hospitals to, I guess, your perspective now having gone through this and being in those groups.
Thank God I don't work in the psychiatric hospital anymore. Thank God I got chronic fatigue syndrome before I found out all this stuff, all these dangers, because I don't see how I could work there. Since so so I'm going along. I'm working. I was a psychiatric social worker my whole 28-year career. So most of the patients and clients I saw were on psychotropic meds. I myself was on a handful of antidepressants. Um, and I thought they were benign. I had no idea. I had no idea about withdrawals or the terrible side effects, about permanent sexual dysfunction in both men and women. Um, I had no idea
Mhm.
until I myself tried to go off Cymbalta, was part of this group. When I first joined the Cymbalta Hurts Worse group, I still had no idea what the dangers were. And I got the taper instructions, and that was it. I didn't pay any more. I didn't log into the group every day. I didn't pay any attention to the group. I got my taper instructions and off I went. And then I got the delayed withdrawals and I got the akathisia. And I was shocked that because I had been reading the post in the group before this happened to me, thinking, what are these people talking about? Their liver is damaged, their vision is damaged, they can't get off the drug. I really had huge skepticism because here I'd worked in the hospital for 18 years and never heard a word about any of this. So then this happened. Then this happened to me. And then I woke up and then I was totally involved with the group. I became a moderator because I didn't want anyone else to ever go through what I went through. And the fact that I had no warning symptoms, that I was going too fast, really struck me as people have to know this. They have to hear this because people still to this day in the group, people will say, I'm going faster now because I'm not having any withdrawals. And I get so alarmed and I'll write, you can't do that. This is what happened to me. So anyway, so how did it change? So then I got involved in a moderators group where I learned these dangers are with all the antidepressants. Then I got involved in a akathisia support group and learned the akathisia group, sadly, is called Living with Akathisia. I cannot imagine living with akathisia. And in the short time that I was in the group, the first 4 months I was in the group, 3 people committed suicide. So my feeling now is this education that I've had about learning about the side effects that can damage someone. This is another thing about Cymbalta. It can damage the liver. It can cause diabetes. It can cause high blood pressure. It can damage vision. Doesn't mean this is going to happen to people, but it can happen. I've been on it 15 years. I never had any side effects. But when you get, or serotonin syndrome, one of my friends was on gabapentin. Am I saying it right?
Sure. Yeah, you are.
Gabapentin. For a second, I couldn't remember. And Cymbalta, she got serotonin syndrome. She was in ICU. She was almost killed. She had to stop a Cymbalta and gabapentin cold turkey, she then had protracted withdrawals for 2 years. So there are reasons you might have to go off an antidepressant suddenly. You won't have the luxury of tapering, and then you run the risk of getting pause. So with all of this, I hope I've explained enough about what I learned from my experience. I now believe they are not benign. I believe that they are handed out like candy, and people are not. Can you imagine if someone was told what the risks were, that you could get permanent sexual dysfunction?
Yeah, I mean, there's something really interesting.
Acute withdrawal syndrome for years and be disabled and never recover. Anyone who's had pause is never fully 100% again. Can you imagine anybody would say, "Oh yes, sign me up for that"? No, there's so many. All the times I was on an antidepressant, now that I have learned this, I will never, ever take another antidepressant again. I will do whatever it takes to deal with depressed mood naturally. Adopt a dog, therapy, exercise, healthy diet. There are lots of ways to treat depression naturally. Unless the person's catatonic or is going to kill themselves. You know what I'm saying? I wouldn't.
Yeah. No, I agree with that.
Hand them out so casually. They're not.
What was it like when you got prescribed it? You know, what did you get in terms of informed consent about the medication? Yeah.
No, nothing. No word. Oh, that's what you want? Here.
Okay.
And I would, when I wanted a drug, I would go and ask for it. You know, I don't think I was ever. No, that's not true. There were the times I was depressed, and I guess there were most of the time it was prescribed by a primary care physician. Sometimes I went to a psychiatrist, but there was not one word. This is why I was so stunned to dive into this world of the harm that these drugs cause. Okay.
And what did you see when you were working in the psychiatric unit and the outpatient settings? Were you ever involved were you ever a part, in the room when the consenting was done for the medications, to start things? I know sometimes in the inpatient units that I used to work at, we do it as a team, the psychiatrist, the students, the social worker, the therapist, and kind of we do it. I wonder if that was a similar experience for you, or was it more kind of separate?
No, I was in treatment teams almost every day of the week.
What did you see in terms of consenting patients to meds and such?
There was none. There was never one word of a warning, not one.
Yeah, I mean, that would kind of be with my experience as well.
And people, if I look. But here, Dr. Joseph, what hope is there? People go into psychiatric hospitals for acute care. They're there. I don't know what it is now, but when I was there, it was 2 weeks, maybe 3.
You're lucky to get 5 days now.
It takes years to taper off a med. And if someone goes into the psychiatric hospital, they're usually on meds. For a lot of them, they're frequent flyers. They're often.
I would say.
But so because they go in, they're just taken off the med, put on another one, because obviously whatever they're on isn't working because they're back in the hospital.
It's not set up for slow tapers, and the problem is, and the reason why I think this is going so long unrecognized is there are plenty of people who do just fine with these rapid changes. And so I think for everyone, this is me pulling numbers out of thin air right now. It might be 1 in 50, who develops this problem there. That means 49 people could walk through the doors of a psychiatric hospital, get ripped off Cymbalta, get put on another medication, and they don't suffer these problems. And so the doctors look at that and they go, this is fine. But when you're looking at a medication where something like 10% of the US population is taking antidepressants, 1 in 50 is a massive amount. It is a massive amount of people getting injured, kind of every day. So, and that's the other curiosity about the antidepressant injury and the benzo injuries is why is it only some people? What are the risk factors that predispose people to this? Because I don't think it's clearly dose or duration. I've heard several people who have been on fairly low doses for short periods of time who have developed this. I've seen many people who have been on huge doses. I'm talking about Xanax abusers taking maybe upwards of 10 milligrams a day, being rapidly withdrawn and not developing the benzo injury. So there's this big underlying
Oh,
susceptibility which we don't know.
you've raised
Yeah.
you've raised such a good point.
Mm.
It's up to 78% of people will get withdrawals from Cymbalta, and I think it's 18% of that 78% will be severe. But you're right, it's hit or miss. Though lots of people will not have a problem.
Yeah. And so it's, the antidepressant folks, they have it worse because at least in the benzo community, it's they have it in the label now that there
Yeah.
can be protracted withdrawal. It's at least you could point to an authoritative, um, drug, a health authority and say this is something. But in the US, there's nothing about post-acute withdrawal in any antidepressant drug labels. And there's also nothing about PSSD. And that's really interesting because in Canada and the EU, the drug labels now warn providers about PSSD, but not in the US. So
Oh,
that's really interesting as well, because you're right. If this stuff was in the label, then a lot of the doctors may, they may, if they read the label, start saying, well, we could put you on this medication, but I want you to know there's a serious risk that you could develop permanent sexual dysfunction. And a lot of people would just say, yeah, no, thank you. But
you're
until
right.
that's kind of recognized by, one of the major health authorities, I think people don't really take it seriously. But I think that one's coming through the pipeline. I would like to hope so.
Me too.
Yeah. So I guess, look, I've lost my train of thought. I actually think you've answered most of the questions that
You've
I
you've
was interested in
asked
asking you
you've
about.
you've
Yeah.
asked all the most pertinent, best questions for me to
Yeah.
pass along the information that I wanted to convey.
Yeah. Is there anything else that you wanted to speak about before we kind of come to the conclusion of the interview?
If somebody wants to get off Cymbalta, I recommend the Facebook group Cymbalta Hurts Worse.
Mm-hmm.
It is the only place, it's the only source of the detailed enough information to get off Cymbalta safely. They also have a website that anybody can access, and it has the detailed taper instructions. And that website is called Healing America Now. And you don't have to join the group to use that information. And I'm going to, we're going to end the interview, and I'm going to think of 10 things I wish I'd said, but I can't think of them now. But
Yeah,
I
that's
thank you.
okay.
Thanks very much for giving me this opportunity to tell my story, because I want to warn people these drugs are not as safe as they seem to be, or as doctors
I think
them
that,
out.
and that's what I wanted you to come on here and say, because I just think it's wonderful to have someone who was actually in the psychiatric, inpatient units and
Well,
outpatient settings who's really now seeing this,
now
because
but
yeah,
here's the thing. I look back on that, and I can't tell you if someone was suffering from withdrawals or severe, side effects, yes, because then they were just given more drugs to treat the side effects. But I don't know if someone was suffering from withdrawals because there was no context for it. So if somebody told me in my therapy session with them that they were having a massive dizzy headache, I would think, well, it's a physiological problem, because there was no framework for me to know, oh, this might be from withdrawals.
it's well said. I like to think in my training that understanding drug side effects was like the Rosetta Stone for me. once I understood what it was, I could finally interpret what was happening with the patients I was seeing, because they're so rampant. And they're always just like you spoke a lot at the beginning, about hypomania and things getting misdiagnosed as bipolar disorder. I mean, it's once you understand drug side effects, I think you're a much better mental health practitioner.
And withdrawals.
Yeah, yeah, exactly. And the withdrawal syndromes.
All
So
right.
I think so. Thank you so much for coming. I'm on the Healing America Now website, and I'm going to dig into it and probably talk a lot more about it.
Okay. Please contact me via email if you want any more information about tapering off Cymbalta.
Great, will do. Thank you so
All right.
much,
Thank
Laura,
you.
and you have a nice
Bye-bye.
day. Bye.
Thank you.